disseminated intravascular coagulation, which is also called consumption coagulopathy or defibrillation. What causes DIC? Infection, obstetric complications like maternity complications, abruptio placenta, such things like that. Neoplastic disease, cancer, and any major insult to the body, like trauma, burn, snake bite, cirrhosis, things like that. Okay, and what happens to you in DIC, or to a patient? What happens to a patient in DIC? So basically, your small blood vessels blockage, your organ tissues, or the organ tissue damage. You will have depletion of circulatory clotting factors and platelets, and you will have activation of clot dissolving processes called fibrinolysis. All right, which means basically it leads to severe hemorrhage. All right, they dissolve the clots, and you basically bleed to death, which is also called severe hemorrhage. Hemorrhage is bleeding. Okay, so basically person bleeds to death. How do you find a person have this DIC? Basically, the lab results will give the lab results. They tell you that the PT and PTT, partial prothrombing time and partial prothrombing time, they're both prolonged. What do you assess in this patient? You will assess, when you assess the patient, you will find petechiae, purpura, and hematoma. Look up the definitions for this and write in the comments. Petechiae, purpura, and hematoma. You will also have bleeding from the IV site. You will have bleeding from the gums. You will have bleeding from the wounds. You will have hemoptysis, which means coughing of blood. You will have GI bleeding, GU bleeding, and you will also have mental status change. You have hypotension, which is low blood pressure, tachycardia, which means high heart rate, and pain. Risk for injury and risk ineffective tissue perfusion would be two nursing diagnoses for this disease. What would you plan for this patient? You will monitor clotting factors, which is PT and PTT. You will also monitor vital signs. You will give them gentle oral care, no toothbrush. You will minimize needle sticks. You will give them very thin needle. You will decrease their pressure points when they are lying down. You will minimize blood pressure measurements. And when you suction, you make sure that there is no trauma at the suction site. You will apply pressure at the bleeding site, and you will decrease their anxiety. Okay? Disseminated intravascular coagulation, which is also called consumption coagulopathy or defibrillation. Hope you got it. If you have any questions, please write them down in the comments. I will try my best to answer them. Okay? Thank you.